This week, we check out Chris Chukwunyere, a development expert focused on strengthening health systems in Nigeria. Chris has worked on projects funded by United States Center for Disease Control, CDC Foundation, and Washington, D.C. Health, amongst others. Let's check him out.
My philosophy of life is to always walk in love, express wisdom, and operate in good character. Hi everyone, my name is Chris Chukwunyere. I'm a health equity advocate and social entrepreneur. Check me out. As a young child, I was born in an urban slum. It's called Amukoko, somewhere that is just very close to Ajegule. I could count about 8 people I grew up with that ended in very, not so good ways. But I'm grateful for the fact that I have parents who ensured that we were protected from the vices that actually made a lot of people derail. I'm a graduate of medical laboratory science from Imo State University. I have a master's degree in business administration from Ahmadu Bello University, Zaria. And I also went to the US for an Atlas Corp fellowship, and I served in a non-profit organization, in fact, the biggest breast cancer non-profit organization in the US. I served there for 18 months, where I learned quite a lot of things that have actually helped me now that I'm back in Nigeria to implement and carry out the passion that I have for healthcare in Nigeria. I also had the opportunity to do a starting block fellowship. It's called Starting Block Fellowship in New York in 2019. I'm also a Presidential Precinct alumni. I was able to attend the Global Leadership Forum in Virginia in the USA. And currently, I'm an Information Futures Fellow at Brown University School of Public Health, the USA. Passion for public health and to become a health equity advocate started as a young person. In fact, there was a time in Ajegule where there was an outbreak of cholera that over 300 people died. There was knowledge gap because they didn't even know how to access health information that can help them manage preventable disease conditions at home for their kids under 5 years or even more than 5 years old. People living in a rural community can actually have access to health information. They can actually have access to health care. The health outcomes within communities can actually improve if we do something about it. And that was why I went into public health, and that has actually motivated me to doing all of the things that I'm doing so far in Nigeria.
Maybe the sugar is too high or your blood pressure is too high.
So I co-founded Inspire World International Foundation with my wife, and our focus is to improve health outcomes within communities, address poverty and hunger issues, and build young people through youth development projects. We've been able to make a lot of progress. We've had several funding from organizations in the US, yes, because we partnered with the primary healthcare centers and the community health workers to provide vaccine opportunities for people. We also went ahead to conduct free medical outreaches within communities. And since we started until now, we've reached over 15,000 people. We've carried out projects on menstrual hygiene management for young schoolgirls. We provided them with free menstrual pads, educated them on how to use the pads. Hello everyone, my name is Chris Chukwunyere. I'm a health equity advocate and social entrepreneur, and you have just checked me out.